Hey Facebook, it's Dr. Rick with an Herbal 411 highlight. So I have an event coming up this Saturday at the Endorphin Effect in Bartlett, and it was originally going to be how to naturally decrease your chances for a heart attack, meaning diet, exercise choices, working on calming practice, medicinal marijuana, or just some other way aside from just taking a statin and seeing your doctor every 3 months. So there are many different ways. There are also many different nutrition plans, and it's a little bit confusing as far as which one's the best, which one is for me, and that's just it. There's a plethora of different ways for healthy lifestyle, but they all have to be dialed in depending on your circumstances, your genetics, or how deep you are into the shit of your disease process. So I'm not saying that we have to move away from Western medicine, but I would like to empower my warriors, my patients, to do the best they can and maybe get off the medicines, or at least deploy common practices that should help you decrease the risk factors that are heading you towards the ultimate expression of disease. And the top 3 killers outside of COVID are still heart attack, cancer, and stroke. The statistics for death in the US have not changed, but you put COVID on top of that, I think it'll just usher in a need quickly to have a healthy lifestyle. Please consider signing up for my Saturday event, especially those of you who feel apprehensive to pull the trigger and become a member at Herbal 411. I understand. With my family, I had to pay $1,800 a month if I continued with Cobra, and $2,000 a month catastrophic coverage if I bought insurance, Blue Cross Blue Shield. That's crazy. That's not sustainable for any family. So I think there's better ways to do it. I think that you have to have somebody translate the data, give you a personalized program. What's termed precision medicine should be personalized medicine. Increases your chances of success. So this is how I'm changing the format. This time I'm going to have a panel of different providers outside of Western medicine all give you ideas about what they would do for your disease process. So we'll probably be able to entertain 3 different cases over the course of an hour and a half. So everything starts at 11. I'll have an acupuncturist, myself, one of my cannabis coaches, a behavioral therapist, nutritionist, a naturopathic doctor in addition, and then an exercise specialist. All these folks can put together a personalized program for you depending on what your diseases are. So I'm going to have this group of healers come up every month. Please subscribe to me on my YouTube channel to find out when the next announcement will be, and go over to Herbal 411, HERBAL 411.com, and you'll see when I have live events coming up. I'll plan on doing it at the Endorphin Effect once a month, and I'll have different specialists line the panel, but it'll be in something called the grand round style. So in the hospital, to problem solve and work with a unified force, at the end of the week present somebody of a complex case, and that's when all the specialists in the hospital show up to listen to the presentation and then give their 2 cents as far as what they would do. It's a great learning tool. Again, it also unifies the specialties, because nowadays we're so fragmented in Western medicine, it's ridiculous. It used to be that the primary care doctor would be the gatekeeper. That's not it anymore. Nobody has time for anything. So you essentially have your disease controlled by medicines or surgeries, but you're kind of on your own. And if you haven't experienced it, the usual way to have doctors take care of the short visit is to have you come back frequently. So when you get to the point that you have to see your doctor every month, every 2 months, it's time to do something about it. So hopefully this gives you a little bit of insight, and also gives you an invite on learning a different approach and possibly deploying change in your life. Always try to express your lifestyle with as healthy a practice as you can think of. And when you have regret over something you ate, something you didn't do, like get outside and walk on water, and listen to that feeling. Don't feel too guilty. but try not to do it again and again. Acknowledge that you might be able to do something better. Don't beat yourself up. Hopefully that hiccup of a bad habit that you expressed will be in the rearview mirror. That's what we have to do, is keep on moving forward instead of staying in one spot. And I think that's what a lot of my patients are stuck with. Don't let Western medicine bog down your approach to healthy lifestyle. And don't let snow bog down your approach to getting outside and exercising. Stay healthy and see you at the next video.